Hi everyone, welcome back to our channel Nursing Bharske. Today we will discuss about the most important MCQ for the NORCET and the other nursing exam. Before starting the video, we will give the unlimited MCQ practice only the 299 to 2099. If you want to join the test series, you can contact with the WhatsApp number. This is the WhatsApp number. You can contact anytime only for the WhatsApp message, and daily you will get benefits of the daily MCQ practice, full structure wise MCQ for the NORCET and other nursing exam, topic wise MCQ and test paper. Let's start the video. Today we'll discuss the most important MCQ. Let's start. A patient is admitted with a diagnosis of acute myocardial infarction. The most notes: the patient has developed sudden shortness of breath and crackles in the bilateral lungs bases. Which complication should the nurse suspected first? Patient is acute myocardial infarction. Nurse notes that develops sudden shortness of breath and crackles bilateral lung bases. Which is the complication? Option A, pulmonary embolism. Option B, right lateral heart failure. Option C, acute pulmonary edema. Option D, cardiogenic shock. The answer will be option C, cardiogenic shock. Option C, acute pulmonary edema. Because following MI, the left ventricle may fail to pump efficiently, leading to a backup of blood into the lungs. That's why option C is not correct, because option C, acute pulmonary, option B is not correct, because right sided heart failures usually present with the systemic symptoms like JVD and the peripheral edema, not in the lungs crackles. So the answer will be option C. Next, while performing a physical assessment on a newborn, the nurse observes a bluish black macule on the lower back or the sacral area. What is the most appropriate nursing action? Option A, document the finding as a Mongolian spot. Option B, reports the finding immediately as a sign of physical abuse. Option C, assess for other sign of thrombocytopenia. Option D, apply warm compress to the area to increase the circulation. The answer will be option A, document the finding as a Mongolian spot. Mongolian spot is the congenital dermal melanocytosis. The features are the flat gray, blue, black pigmented areas, commonly found in newborns in African and the Asian or the Hispanic descent. So the answer will be option option A. Next, a patient is receiving a continuous intravenous infusion of magnesium sulfate for preeclampsia. Which finding would require the nurse to stop the infusion immediately? Option A, respiratory rate of 16 to 20 breaths per minute. This is a normal. 12 to 20 is the normal. Absence of deep tendon reflexes. When the absence of deep tendon reflexes occurs, this is the early sign of the clinical sign of magnesium toxicity. If the infusion continues, it can lead to respiratory paralysis and the cardiac arrest. So this is the cause when we have to stop immediately the magnesium sulfate. Urine output 40 ml is normal. It should be 30 ml. Complaints of the warm flushed feeling is a common expected side effect during the loading dose. So the answer will be option B. What are the criteria for the magnesium toxicity? Magnesium toxicity, we should not continue to the magnesium deep tendon reflexes absent deep tendon reflex, option 1. The urine output 30 ml, less than 30 ml. When it occurs, we have to stop immediately. And the respiratory rate, when the respiratory rate less than 10, we should definitely stop the magnesium sulfate infusion. Next, which of the following is the most definitive diagnostic test for the confirming the diagnosis of the Hirschsprung's disease in an infant? Option A, abdominal X-ray. Option B, barium anemia. Option C, rectal biopsy. Option D, anorectal manometry. The answer is option C, rectal biopsy, because Hirschsprung disease is characterized by the absence of ganglion cells in the distal colon. Rectal biopsy is the gold standard test because it allows the for microscopic examination, for microscopic examination of the tissue to confirm the absence of these essential nerve cells. That's why the answer rectal biopsy is correct. Why not others? X-ray or the barium anemia can show the megacolon or narrow segment, but they don't confirm the cellular causes. Manometry measurement pressure, but is less definitive than tissue sampling. So the answer will be option C, rectal biopsy. Next, the nurse is caring for a patient with chest tube. During the assessment, the nurse notes continuous bubbling in the water seal chamber. How should the nurse interpret this? Option A, this is a normal finding if the patient is coughing. Option B, there is an air leak in the drainage system. Option C, the lung has full re-expanded. Option D, the situation pressure is set to high. The answer is option B, there is an air leak in the drainage system, because in the water seal chamber, tidling, gentle rising and falling with the breath is normal. Tidling is normal, but continuous bubbling indicates that there is an air is entering in the system from a leak. Air entering the system from leak, either at the insertion side, the tubing connection, or within the drainage unit. Why option A is not correct? Because intermittent bubbling is normal during coughing or exhalation in the patient with the pneumothorax, but continuous bubbling is always a leak. Next, what is the priority nursing intervention for a patient experiencing an acute episode of mania? Option A, encourage the patient to participate in the group therapy sessions. Option B, provide high calorie, nutritious fiber foods. Option C, orient the patient the ward rules repeatedly. Option D, allow the patient to lead the vigorous exercise. The answer is option B. Provide the high calorie, nutritious finger food, because when the patient is going through the mania, the patient can't sit and eat the full diet. So we have to provide finger foods. We have to provide the finger food and the juice or drink repeatedly. So the answer will be option B. Next, a patient represent with a trouser sign and chauvistic sign. Which electrolyte imbalance should the nurse suspect? Option A, hyperkalemia. Option B, hypocalcemia. Option C, hyponatremia. Option D, hypermagnesemia. The answer is option B, hypocalcemia, because low calcium level increase the neuromuscular irritability. Chauvistic sign, facial twistings when the facial nerve is tapped. The trouser sign, carpal spasm when the BP cuff is inflated, are the classical indicator of the tetany caused by the hypocalcemia. So the answer will be option B, hypocalcemia. Next, the doctor orders 1000 ml of normal saline to be infused over 8 hours. The drop factor is 15 GTT per ml. What is the flow rate in drops per minute GTT? The calculation will be D by A into Q. Doctor's order by available dose into quantity in hand. Here D means doctor orders 1000 by 8 hours. They ask for the minute. 8 into 16 into quantity in hands means 15. 0 0 3 2 here we will do the calculation next. Okay, one second. 1000 by 8 into 16 into 15 4 4 4 125 by 4 31.25. The answer will be 31.25. Let's see. Here is the 21 no, 42 no, 31 nearby 31 to 31.25 near 31. So the answer will be option C. Next, which position is most appropriate for a patient immediately following a liver biopsy? Option A, left lateral position. Option B, right lateral position. Option C, semi-fowler position. Option D, supine with leg elevated. The answer will be option B, right lateral position. The liver is highly vascular organ located on the right side of the abdomen. Why the option B is the correct? Because placing the patient on their right side applies pressure to the biopsy side against the chest wall, which helps to prevent the hemorrhage. So the answer will be option B, provide the patient in the right lateral position. Next, while administering an enema, the patient complains of the abdominal cramps. What is the best initial action by the nurse? Option A, stop the procedure and notify the physician. Option B, lower the enema bag and slow the rate of the flow. Option C, encourage the patient to hold their breath. Option D, advance the rectal tube further. The answer is option B, lower the enema bag to slow the rate of the flow. Because abdominal cramping is often caused by the rapid distension of the colon by the fluid. Why option B is the correct? Because lowering the bag reduce the hydrostatic pressure. What will happen? Reduce the hydrostatic pressure, slowing the flow and allowing the bowel to relax without stopping the procedure entirely. Encourage the patient to hold their breath. No. If holding breath means Valsalva maneuver, increase the intra-abdominal pressure and the discomfort. Stopping is unnecessary unless the patient is severe or bleeding occurs. So the answer will be option B, lower the anemia bag to slow the rate of the flow. So option B is the correct answer. Next, a nurse is assessing a pregnant woman at 32 weeks of gestation who complains of sudden painless bright red vaginal bleeding. What should the nurse avoid doing? Option A, assessing fetal heart rate sound. Option B, performing a vaginal examination. Option C, monitoring maternal vital signs. Option D, placing the patient in a sideline position. The answer will be option B, performing a vaginal examination. They asked for the avoid except performing vaginal examination, we have to do everything. Assessing the fetal heart sound is the most important things during this condition. This condition is the placenta previa. Placenta previa, they told the features of placenta previa is painless vaginal bleeding, sudden painless vaginal bleeding. So the answer will be option C. Next, while monitoring a patient with a head injury, the nurse notes a widening pulse pressure, bradycardia and irregular respirations. What does this Cushing triads indicates? Option A, hypovolemic shock. Option B, increased intracranial pressure. Option C, spinal cord transaction. Option D, septicemia. The answer is option B, increase the intracranial pressure, because Cushing triad is a late sign of the brainstem compression. As ICP increase, the body increases the systolic BP, SBP, systolic blood pressure, to maintain the cerebral perfusion. Cerebral perfusion means widening the pulse pressure. The vagus nerve is the stimulated, causing the bradycardia. So the answer will be option B. Thank you everyone. Please like, share and subscribe our channel, or if you want to join our test series, please message in this number. If you want to specific subject also, they will provide each and every topic clearly for the test series. Thank you everyone. Please like, share and subscribe.